Hello, this is Dr. Tae, and today's episode we are going to talk about turmeric. Turmeric is a common herb that a lot of people are taking these days and is known for its anti-inflammatory properties. And a lot of people take it because people just have a lot of inflammation and it's a good alternative. And there are people who take it as a supplement, but for a lot of people, it's in their food, especially coming from Southeast Asia, where around India is as well. And it dates back thousands of years. This is one of those herbs that people have been using for thousands and thousands of years. And eventually it made its way into China. And in Chinese, they call it Yu Jin. And it's got wonderful properties that helps not only with your skin, but also helps with your digestive system and, of course, inflammation. Now, let's go into it. Okay, this is from the website from the John Hopkins Medicine. And in this article written by Mary E. Brown, who's a registered dietitian, I believe, and she talks about all the good benefits of, a turmeric. But one thing I do like to point out is that in this article, it talks about when you take it with black pepper, a substance in black pepper called piperine, when combined with curcumin, has been shown to increase bioavailability to by 2,000%. So, if you take turmeric and eat it with black pepper, it just makes it more bioavailable. And this is one of the great things how herbs work when you take it with certain things together. It works great. Another ingredient that people know that it helps is fulvic acid. So when I used to take turmeric on a consistent basis, this was many years ago, because once you're doing this, you got to take it yourself so that you can recommend it to others and see and tell people what it tastes like and what the effects are and so forth. So when I used to take it on a regular basis, I would do this experiment where I would take the turmeric for about 1 week straight, and then I would start taking it turmeric with black pepper. So I would make this like hot water and break up the capsules and add some black pepper. And I would say I did feel somewhat of a difference, obviously in the taste, but more so in terms of how you feel in terms of the inflammation. Two, I would add the fulvic acid. I would drop these fulvic acids, and that's what I would say made a world of a difference. It's close to, I wouldn't say it has a liposomal effect, but it's close to that. It makes it more absorbable to the body. And I've given turmeric for people. A bunch of my patients tell me, oh, I'm about to go through my hip replacement surgery or whatever the case is. And they come to me and say, hey, my doctor told me not to take any supplements right before surgery. Is there something that you would recommend? I'm like, well, I don't want to go against the doctor's orders. However, I can tell them that, hey, traditionally, turmeric is found in people's foods, right? So I'm not saying take the turmeric, right, as a supplement, but take it as food, like Indian food right before your surgery and things like that. And they're like, and their light bulb goes off. And I had one patient where they took turmeric and fulvic acid in combination for about 2 weeks leading up to the surgery. And after coming out of hip replacement surgery, he went home that day, where most people would stay in the hospital recovering for a day or 2 or 3 days, 4 days, 5 days. This guy just went home right away. And the family noticed, okay, whatever Tay recommended, I think that's what helped him recover so much faster, because after surgery, he had the body had all this turmeric and just bring down the inflammation. Now, would I recommend this to go against your doctor? Of course not. Please talk to your doctor or healthcare professional before doing anything like it. But if you're eating turmeric on a regular basis and with your food, I think that's totally okay. Now, let's go to this long uh, article. And instead of getting into it so much, they talk to you about the history of this herb and the composition of turmeric and all these different compounds and stuff like that. and where was, turmeric was used as a traditional medicine, and how it pervades into modern life, and what are the studies. And what they're showing is that in mice, when they're injected with these things, it has an effect on the cancer cells. So there's a lot of studies being done. Now, will this replace chemotherapy and radiation? The answer is no. Will it? Um, will it be good to take it on a consistent basis? Perhaps, right? But do I see this, changing in a significant way? The answer is no. But it's good to take it overall. And I also recommend turmeric for people um, who don't feel all too well since the pandemic. Let's just put it that way. Okay. And turmeric, it has a lot of clinical evidence that it has a positive effect on acne, atopic dermatitis, eczema, psoriasis, and vitiligo. It has an anti-inflammatory effect. Uh, it's got an antioxidant effect, antimicrobial, and so forth. So in that regard, it's just a good thing to take, for anti-inflammatory effects across the board. And another one was turmeric in terms of the multifunctions of health benefits. And basically, it goes to show you that the inflammatory cytokines such as interferons and interleukins and tumor necrosis factor inhibiting the inducible nitric oxide synthase enzymes and suppressing the activation of nuclear factor kappa B has been noted for its anti-inflammatory properties. And once again, it's really good for anti-inflammatory if you're having a lot of inflammation. But better yet, if you have a lot of inflammation and you want to get rid of it, just stop eating sugar. But I know sugar is highly addictive, so it's really hard. But if you could control your sugar levels and other inflammatory markers that your body may be suffering from, for a lot of people, I found it was causing them to have some sort of like hormonal disruption was because they were using a lot of perfumes on a consistent basis. A lot of these perfumes or colognes have chemical compounds that makes them smell that way, but they're what they're called um, endocrine disruptors. And for some people, they started having allergic effect because they were using it over a long period of time, and their body couldn't process it and out. So eventually, they had to an inflammatory effect. And I was recommending them take turmeric and stuff like that, and it kind of like helped. But when I told them to stop wearing their perfume, they kind of got a little bit defensive about it. And but when they started doing that, their inflammation systemically just dropped significantly as a whole. Now, there are stories, I don't know how true because this was told to me in oral tradition in Chinese medicine because turmeric was not mainly from China. They had to import it, and then they grew it in China as well. But people didn't like to use it as a form of medicine. And there's a guy named Sun Simiao. Uh, he wanted this to come into the Chinese Materia Medica, and now it's part of the Materia Medica in Chinese medicine, and is used for a lot of what is that, Chinese medicine ingredients. And one thing that we know in Chinese medicine is that yujin, or AKA turmeric, alleviates pain, abdominal pain, dysmenorrhea. That's when you have like a lot of painful menses, or amenorrhea is when you have the absence of menses, abdominal masses, pain distension, fullness and tightness in the chest, and also used for childhood nutritional impairment. So it's got a lot of different um, key factors, but I want you to note that this is especially better for women than men, especially around their cycles, because this ingredient has the ability to move blood, breaks up blood stasis, and dissolves accumulation. And because of this effect, it is good for any type of masses that you're trying to get rid of in the body. And because it has the ability to break up stasis, um, just like women's time of the month, this type of taking, I believe, turmeric tea and hot water as some black pepper, and make it very interesting. Add it with other teas, and this is really good for that. Okay, why can't I get the mouse to work properly? And then there we go. And a lot of supplements are now they're including things like turmeric and fulvic acid together because they found that out. So I've been recommending that for years, but now since they're doing that, it's good to see that they're doing that. And last, yes, turmeric is a key ingredient in curry powder, is one of the ingredients along with many things. And guess what? Black pepper's in there, right? So eating curry on a consistent basis, don't eat it with so much cooked vegetable oil because that causes a lot of inflammation. So it depends on how you do it. So if you want to use the, how do you say, biohacking, healthy cooking way, I think it's important that you cook with ghee, butter, and or tallow as the base to mix all these ingredients together. And now, of course, everybody uses canola oil, cooked vegetable oil, which I'm totally against. I'm totally against cooked with vegetable oil, including coconut oil. And people are saying, oh, the specific heat, it's not going to create trans fat, but they do. Okay, that's the thing, that they do. So I think it's a marketing ploy. And that's pretty much it. So I would totally recommend taking turmeric on a consistent basis. I would recommend it in your food. You can flavor your food with it in soups, and especially, I would recommend putting black pepper right before you eat it. All right, now having said all of these things, hit the like button if you like content like this and would like to hear more about herbs. And I'm going to be talking about individual herbs for a while, and then I'm going to start talking about good formula and the theories behind it. So hit like, subscribe, and hit the notification bell for future videos. All right, thank you. Bye bye.